Hey everyone, it's Dr. Mitchell. We're answering a question here that was asked on Instagram, which was essentially, are biologics safe? Are they effective? Should I use them? Should you use them? I don't know. That's a question more appropriate for your rheumatologist or whoever is caring for you. But I can take on the other two pieces. Are they effective? Are they safe? Why is a naturopath talking about drugs? Why the hell is a naturopath talking about drugs? Let me preface this all by saying that I fully believe in, I subscribe to the idea that you can treat things naturally. You can do it. You can change your diet, you can change your lifestyle, you can address these different root causes that are talked about, chronic infections, mold, toxicants, heavy metals, toxic people, and so on. You can do all of that. You can do it. You can get remarkably better. Some people might even achieve remission. I've seen it. It can be done. But not everybody's case is amenable to these things. We can't always find the root cause. There's other circumstances that make this difficult. Maybe we can have a long format discussion sometime about these things. But everybody's case is different. Not everybody's lupus is the same. Not everybody's rheumatoid arthritis is the same. And so not everybody's case is amenable to natural alone. The nature cure practitioners in the past said it themselves. The nature cure practitioners in the future are going to have a very difficult time treating patients with chronic illness. Why? We're becoming less resilient as a species, and our world is different, so that we are subjected to many more stressors than the people of the past were. And so anybody telling you that it's simply because you're not compliant, you're lazy, you don't have the willpower, you're not ready to get better, these things do factor in sometimes, but not always. And if anybody's telling you that they always factor in, they're simply having an agenda, they stand to gain from you, they're delusional, or they're not thinking about things in a sophisticated way, which is the root of many problems in the world today. People think binary, they think black and white. There's a lot of gray. There is so much gray, especially in rheumatology, which is what makes it more fun. For me as a clinician, not you as a patient. I understand how frustrating it can be. But biologics, they've made a huge difference in people's lives. If you know anything about the history of rheumatology, 50s, 60s, all we had were buckets of aspirin, penicillamine, gold, things like this. Patients didn't do well. Patients had shorter health spans, they died earlier, they were slated for dysfunction and disability. These severe outcomes, they're no longer the case today because of these recent pharmacologic developments. These biologics, they make a huge difference in people's lives. They preserve health span and functionality. How do they work? They target your immune system. Your immune system fires off text messages called inflammatory cytokines, TNFs, interleukins, these cytokines, IL-17s, and then you have signal transduction pathways. That's kind of like an email going into an inbox that causes a series of events and actions to happen. All of these things are dampened by these biologic agents, and the inflammation goes down and the disease is controlled. They make a remarkable difference, okay? And we have many therapies available for a lot of different autoimmune diseases, but there are a few for which we haven't figured them out yet, like lupus and scleroderma, but there's more developments on the way. Are they safe? For most patients, they are safe. But remember, in dropping that inflammation, you're causing some problems. Inflammation is good. Inflammation helps us fight off infection. It helps us in normal surveillance processes in our body, right? And so the two big things we have to think about are infection and cancer. So when you drop these inflammatory cytokines, surveillance goes down. The cops, they go to the donut shop. They're sitting on their ass, eating their donuts and drinking their coffee. So now critters that are on you, around you, okay, they can come out onto the streets and wreak havoc, and you can get serious infections that can hospitalize you. And for many, there won't be any further complications. You can stop the drug, you can address the infection and be fine. For those of you who are more frail or have certain health circumstance issues, that can be a big problem. Okay, and so that's something you need to be aware of. Cancer. When we drop these inflammatory cytokines, again, the cops are checked out. We use those surveillance processes to manage cancer cells that we make every day. Everybody has cancer in their bodies. Everybody has cells that no longer want to be part of the community. That's essentially what cancer is. It's anarchy, it's mutiny, it's some cells saying, I no longer want to be a part. We're going to start our own community and we're going to hoard all the resources for ourselves. And we use these surveillance mechanisms to keep these rogue cells in check and keep them from doing that. And so this is a potentiality. I've asked a lot of different rheumatologists about this. I've looked at some of the data myself. And most of the rheumatologists and experts out there will say that there is no evidence that biologics cause substantially increased risk of cancer. No evidence doesn't mean it doesn't happen. It can happen, but it's not something we need to be as concerned about. And they'll cite these Taiwanese registries where biologic users are tracked over several years, and we don't see dramatically increased incidence of cancer. But I would say the jury's still out, because this whole mutiny process is a slow, evolving process that happens over many years. And biologics are relatively new therapies. And so I would say we just don't know. But so, are they effective? Yes. Are they safe? Mostly. I hope that answers the question. Remember that things are different in this world today. Not everybody's case is amenable to natural alone. Ideally, you'd use a jointed approach, and maybe you don't need the medications your whole life. Maybe you do. And if you do, that's okay, because we want you to be healthy. We want you to be able to express your gifts and be functional. And that's all health is. And it doesn't matter how you achieve that. What matters is that you can live the life you want to live, whether that's drugs alone, whether that's natural alone, whether it's some combination of both. This is Dr. Mitchell signing off. Dude Looks Like a Lady is playing now. I'm going to switch this song because I don't like this song. Everybody have a good rest of their day.